As a psychologist, I often work with clients whose past is influencing them in a way that makes their behavior look irrational. What's happening is implicit memories, which Professor Mason talked about in week 10, are getting triggered. And since they're not well integrated in the neocortex, they're influencing behavior at a level below conscious awareness. Professor Mason talked about emotional implicit memories and how we can know that we feel uncomfortable, but not know why. As an example, we can talk about an adult who's had numerous experiences as a child with a critical rejecting parent. What that implicit memory neural net might look like is something like this, where we have repeated events, in this case of a critical rejecting parent. We have emotion, which in this case is likely to be fear and shame. We have thoughts, particularly thoughts about the self, such as I'm not worthwhile, I'm not good enough, and a behavioral response, which is likely to be a sympathetic nervous system fight or flight response, fight being an aggressive response or flight being a withdrawal response. Professor Mason talked about how expectations influence perception. And this can lead to a perceptual distortion. When somebody is expecting to receive criticism or rejection, they can see that where it doesn't exist, and therefore respond as though they're under threat, which looks irrational. Treatment in this case involves essentially establishing integration with the neocortex, or more specifically, the middle prefrontal cortex. And what this does is allows executive functioning to be operating, a higher process rather than just a conditioned response. We do that by first bringing this implicit memory neural net into conscious awareness, in other words, into working memory. And we do that with the thalamus, which directs our attention. Professor Mason talked about how when we recall a memory and then we restore it, we're restoring it in a slightly altered form. What we're doing now is making this memory available to be changed. And we can do that, we can get connection with the left middle prefrontal cortex by establishing a narrative or doing storytelling about these events so the person has better understanding of it using language. And Professor Mason talked about the left hemisphere being utilized with language. We can also get integration with the right middle prefrontal cortex through several ways. One is merely by naming the emotion, or with young children we sometimes talk about name it to tame it. There's some research that shows when we name an emotion, this calms the amygdala, which is an emotional center in the brain and is involved in the sympathetic nervous system response. The research shows that there's a decreased blood flow to the amygdala and a concomitant increased blood flow to the right middle prefrontal cortex. We can also help get integration to the right middle prefrontal cortex by utilizing the relationship. And Professor Mason talked about the importance of interpersonal neurobiology in her last segment. But when this memory is being talked about in a comforting setting, in a compassionate setting, we're adding comfort into this neural net, changing it in that manner, and also decreasing the emotional intensity of it so it's not feeling so powerful. At a cellular level, this connection is getting established through the soothing neurotransmitter GABA. This course has enriched my life by helping me to have a broader and deeper understanding of the brain, which allows a deeper compassion for me for my clients. The source for this presentation is Bonnie Badenoch's Being a Brainwise Therapist, and the citation is right here. Thank you.